Good morning, everyone, and thank you for the opportunity to speak with you this morning. My name's Greg Pratt. I'm sorry I can't be there in person. I'm actually on my way to speak with some of our people, friends, colleagues, and peers in Canada at the Summit for Indigenous Genomics. So unfortunately, I can't be in two places at the one time. As I said, my name's Greg. I'm a Principal Research Fellow at Central Queensland University and also Principal Research Advisor at the Queensland Aboriginal and Islander Health Council, QAIHC. And I'm joining you virtually today. There are a few of my colleagues and peers in the room who will be available to answer questions if you do have any. But this morning I wanted to speak with you a little bit about the promise of genetic healthcare and precision medicine and some of the work that we've been doing and I've had the opportunity to lead with respect to improving access to those services and ensuring equitable access to those services and research. I'm going to be talking a little bit later about this diagram or this document on the left, which is our integrated genetic healthcare framework that we had the opportunity to develop most recently, but also some of the work leading up to this. I hope you enjoy the presentation, and if you have any questions, my details will be at the end of this presentation, and you're welcome to contact me or have a conversation with our peers in the room, who I'll get to in just a moment. Thank you. Before I begin, and in line with cultural protocol, I'd like to pay my respects and acknowledge the sovereign rights of the traditional owners of these lands, air and water. I thank them for their caring for Mother Earth and pay my respects to elders past, present, and to our emerging First Nations leaders. I thank the diverse and numerous First Nations of this ancient continent for the privilege and opportunity afforded to me as an Aboriginal man and descendant of one of the oldest living cultures on the planet. I'd also like to introduce myself as an Aboriginal man, descendant of the Quandamooka Nation, specifically the Brown family, and Minjerribah, as it's traditionally known. I also had the opportunity to grow up with the Kuku-Yalanji and the Kuku-Taipan people in far north Queensland, and I'm joining you today from my own home country as I record this of Quandamooka lands at Wynnum. So thank you all, and thank you for the opportunity to be here.
Your blood, your story. In our world, we are surrounded by things that affect us and make us who we are. Some can make us stronger, some can make us sick. But sometimes when we feel sick, it isn't easy to find out why or how to get better again. Sometimes the answers can be inside of us, in our body and in our blood. Inside of our bodies exists a world that can tell many stories about us, about our connection to one another and the world we live in, about our connection to earth, air and water, and about our past and our future. We have knowledge inside of us that has been passed down from our ancestors for generations, knowledge that has been handed down to our grandfathers and our grandmothers, fathers and mothers, and so on, all the way to us and our children. All these stories are kept in something called genes. Your genes are made up of your DNA. This is all through your body and all through your blood. Through tests, our doctors can read these gene stories to learn more about our health. This is called genetic testing. Looking at these stories in detail through genetic testing can help your doctor identify medical conditions that we and our families might have or may get in the future. It can tell us the chance of intellectual or physical disabilities, the risk of your baby inheriting a genetic condition, or if you have a family history of a genetic condition such as cancer. Doctors can use the information from genetic testing to design unique treatments that will work better for you. This new technology is called precision medicine, and your doctor can provide advice about whether you should look into genetic testing. Medical research organisations like QAIHC Berghofer are working hard to better understand the stories of DNA and genes for the benefit of everyone. Understanding our gene stories on the inside will help us get better on the outside. Through this medical research, we are helping everyone live healthier, happier and longer lives. Reading gene stories is an important part of understanding conditions such as infectious diseases, mental health, chronic disorders and cancer. If you or your family have any concerns about your health that might be linked to your gene stories, you can talk to your doctor to discuss your options. If you would like more information about genetic health and genetic testing, you can visit www.health.qld.gov.au/GHQ. Genetic Health Queensland is a free service and is part of the public Queensland Health Service. If you know of someone who might benefit from this information, a family member or friend, please share this video with them. Thank you.
So the plan this morning is I'm just going to give everyone a little bit of an overview to some of the work that we've done, as I mentioned, a bit of a background of a service environment, also the history with respect to some of this work, and then more specifically some of the work that we did in co-designing and consulting with people in partnership to develop a suite of strategies and recommendations that hopefully will have an impact and benefit First Nations, Aboriginal and Torres Strait Islander people. So most of the work that I'm talking about here today is in specifically about the jurisdiction that is Queensland, obviously, and the peoples that live there. And then hopefully at the end I'll have some good news for you in relation to where to from here and the future of the work and the space going forward from a Queensland national and international context. So just quickly, a little bit of background in terms of historical and geographical context. Australia is an ancient continent, and the First Nations peoples collectively of this great nation, of this great continent, have lived here for more than 60,000 years. Prior to European colonisation, there were over 400 language groups on a continent equal in size to most of Europe and equal in size to the United States of America, a massive space. And while we use terminology Aboriginal and Torres Strait Islander to conveniently refer to these groups or this group of people, we recognise that it is a significant number of peoples with very different, very unique cultural beliefs, traditional beliefs, and who have been here for a very, very long time. The Torres Strait in itself refers to an area north of Cape York, Queensland, and includes over 200 islands, 17 of which are populated and separated into 5 traditional island clusters. And as I said, while we use the word Aboriginal to refer predominantly to mainland Australia, we do so conveniently at the expense of not necessarily recognising the unique and diverse peoples, cultures, traditions, groups, clans, moieties that existed here and continue to exist here now, some 250 years after European colonisation, but from 60,000 plus years ago. Additionally, I just want to quickly refer to a document, the IATSIS code of ethics for Aboriginal and Torres Strait Islander research. And the reason I do that is obviously today we're speaking a little bit about research. And the reason I think this is a particularly important document for people to read is because it uniquely and in many ways in the first instance describes in detail what we consider to be Aboriginal and Torres Strait Islander research. So I'll just read this. It's on page 6 of that document that you can find online. Aboriginal and Torres Strait Islander research includes all research that impacts or is of significance to Aboriginal and Torres Strait Islander peoples, including the planning, collection, analysis, and dissemination of information or knowledge in any format, medium, which is about or may affect Indigenous peoples either collectively or individually. A very important document and pivotal and significant in supporting a conversation which prioritizes and emphasizes the importance of Aboriginal and Torres Strait Islander self-determination and sovereignty, in particular in the space that is research. So if you haven't read it, go read it, and please refer your colleagues to it and use it to support your work and the work of our peoples, for our peoples, by our peoples, for community. Thank you. So, setting the scene, Queensland, big state, twice the size of Texas. You can get in a plane and fly from Brisbane, get to Cairns 2 hours later, if you're lucky. Get in another plane, fly north for another hour and a half, land in Thursday Island, or rather Horn Island, and then catch a ferry up to TI. Still not be at the tip of Australia. Get in a dinghy and travel another couple of hours by tinny all the way up to Boigo and Saibai, and Bardu, and you've just basically covered north to south. We go west a similar sort of amount of distance. It's a big state. In this environment, however, I think there's, from a health service perspective, 2 important notes to make. We have a tertiary hospital and health service, the public hospital and health service, Queensland Health. We also have a primary health service sector. And here in Queensland, we're very proud of our Aboriginal and Torres Strait Islander community-controlled health service sector and the organisations that occupy that space all the way from Thursday Island down to the southeast and west out to southwest Queensland and central Queensland as well. Now, in terms of equitable access, tertiary health is predominantly provided through our public hospital and health services. There is a private space that obviously also occupies that space. Principally, it's a biomedical model, it's illness-centric, and it's acute care focused. On the flip side, and in a complementary fashion, we have what we refer to as primary health. And in our community control sector, that is the Aboriginal and Torres Strait Islander community controlled health service sector, you can see on the left here, QAIHC and its members have developed this model of care that centres the family at the centre of how we do things. So it's a holistic model. It talks about whole of health. It talks about the person, the family, the importance of community. It talks about prevention, promotion, early intervention. How do we support people to stay well, emphasising the importance of wellness over illness, which, as I mentioned, is typically a focus when we're thinking about a biomedical model and typically a focus when we're thinking about tertiary and public hospital and healthcare. So, from a genetics healthcare perspective or a genetic healthcare perspective, Genetic Health Queensland is the statewide public clinical genetic services. And I'm just going to speak briefly, and unfortunately my colleague Professor Julie McCaughrean, who is the Director of Genetic Health Queensland, couldn't be there today to meet with you all, but hopefully I'll do her justice. But they offer a suite of clinical genetic services. And what we mean by that is the practice of clinical medicine that involves the diagnostics, management, prevention, prognosis, and counselling of genetic disease. Genetic Health Queensland comprise a team of clinical geneticists, clinical genetics advanced trainees, and immersion registrars, genetic counsellors, and obviously admin staff and support services and support staff. It's a public clinical genetics service in Queensland, and it's statewide. And while it's based at the Royal Brisbane and Women's Hospital, it does offer face-to-face clinics in Brisbane, the Gold Coast, Sunshine Coast, Toowoomba, Bundaberg, Rockhampton, Mackay, Townsville and Cairns, with telehealth appointments available to people in their home or at a local healthcare facility where clinically appropriate. It's available to anyone who lives in Queensland who has a genetic condition, is suspected of having a genetic condition, or has a genetic condition in the family and wants to understand what this means for their own health. It's a public service. It's a part of our Queensland Health public hospital and health service, and that means there's no cost to the patient. There's no cost to families for appointments or testing. And generally what that looks like, those appointments, is a discussion about a condition, about genetics, about risk. It might be offered in the form of a genetic test, but not always. It's voluntary, and if the person is referred to have a test, that's fully funded by GHQ at no cost to patients or families. In terms of what the services look like from an Aboriginal and Torres Strait Islander perspective for the last little while, between July 2018 and November 2020, so that period when we had this little thing called a pandemic happening, 717 patients identified as Aboriginal and Torres Strait Islander and attended a total of 1,292 appointments during that period. Those referrals were from specialists, they were from GPs, they were from our ARCHOs, and they were also from, other hospital and health services and some sources that we didn't quite know where they came from. You'll also see in that bar chart down the bottom there, in the bottom left, that overall patients at GHQ, there are around about 10 to 12% who actually were Aboriginal or Torres Strait Islander and identified as Aboriginal or Torres Strait Islander. So GHQ is a service that's accessed by First Nations peoples. Genetic testing, when it's offered at GHQ, can be single gene or it can be gene panel. And it utilises several national and international testing laboratories. And in some instances, and it's starting to be introduced now, whole genome sequencing is being offered. Patients are typically referred to GHQ for cancer, for cardiology, for prenatal and renal sources. So it's a fairly comprehensive service that people are accessing, and similarly that we are very passionate, and that I can attest Julie and her team at GHQ are very passionate in making sure our Aboriginal and Torres Strait Islander people's public have access to. So, just a little bit about consultation, co-design and partnership. As I mentioned before, I'm going to give you a bit of a brief history of some of the work that we've done, starting off in the policy space, lending into the public awareness and health literacy space, and finally ending in a space which I like to refer to as health reform. So the first part I want to make reference to here is where we started approximately 6 years ago now, I guess. That's not that short, that's not that long ago, but a little while ago, when we started a series of conversations with the community around their interest and appetite in genomics, genetic testing and precision medicine. And it was essentially to develop a set of guidelines for genomics researchers about what First Nations peoples of Queensland would prefer. We used a participatory action research method, and we co-designed and empowered community and stakeholder voice to essentially try to get some sense of whether people were interested and what their preferences might be in terms of involvement in research, involvement in healthcare. So we did this over two spaces, one which I like to refer to as affirmation, the second being confirmation. Our affirmation roundtables were essentially 5 7-hour workshops across Queensland, not exhaustively, but in the regions of Far North Queensland, North Queensland, Central Queensland, Southeast and Darling Downs, talking with people to identify and introduce really what genomics and precision medicine was all about and what it might look like from a community controlled health perspective. But really with the goal for the community service sector to tell us what they wanted when and if they were going to be involved in genomics research, what that might look like. Round 2 was really going back and seeing if we got the key messages that we then included in that document. I mentioned genomic partnerships, right? Seeking feedback on how representative the document was of our previous discussions. So without going into too much detail, you can have a look at that document. There's a QR code for it. Feel free to scan that with your camera now, and you should be referred to the website where you can download the document. I'll also put the QR code up at the end of this presentation. And that document was released in October 2019. Now, the second piece that I just want to quickly go over is the public awareness and health literacy piece, which we started back in 2019 and it culminated in about 2020, 2021. Now, as you would have seen that video at the start, it's a general introduction into the space that is genomics, precision medicine, DNA, and genetic testing and genetic healthcare. To land on that animation was not simply a matter of our researchers deciding what that looked like. So in order to get to that space, we conducted 11 two-hour workshops across Queensland over 3 months between September and November in 2019, seeking feedback on what to include in a suite of draft resources and identifying preferences for the communication of information about genetic health and genetic testing. This also included media and medium preferences. So how did people want this information to be communicated to them? We also engaged with a number of artists for each of the regions, and that was in response to the feedback that people had given to us through our consultations in genomic partnerships and developing that policy document, that we needed to be regionally sensitive, and when people were looking at this stuff, they needed to know that it was relevant to their local area. Like I said before, not all Aboriginal and Torres Strait Islander people are the same, and we're not just one big collective group of people. We have very different and diverse beliefs, traditions, practices, and so people wanted to be able to identify there. So we commissioned some artists to do some work for us, and we included that art in a series of trifold brochures, some of which will be on your table in front of you as you're there today. I believe my colleague Greg Richardson, who'll probably wave at this point in time, can give you more copies of that if you need, but they give a little bit of background information, and they're regionally sort of identifiable for each of the spaces, and the artwork represents that. And finally, like you would have seen that video, you can actually go onto YouTube, you can find that video, you can play it, you can use it, you can share it with your friends and family. The QR code's there and should help you to get to the space where you'll be able to download it or view it. Finally, the last piece I want to talk about is this health reform piece, and more specifically integrated genetic healthcare. So what we've done most recently is QAIHC, Genetic Health Queensland, QAIHC Berghofer, where I was historically up until recently for about the last 12 years, and more recently Central Queensland University, where I currently am housed and am very proud to work, co-facilitated a series of workshops across Queensland. We consulted, we conferred, we engaged, and hopefully we empowered community representatives and champions, the community controlled health service sector and the public hospital and health service sector, to co-design a preferred healthcare model and identify our preferred referral pathway for improved access to genetic testing services of GHQ. To do that, we ran again 9 workshops across 9 regions in Queensland, and we had those workshops in this instance with the community controlled health service sector and the public hospital and health service sector. Disclaimer, it wasn't exhaustive, but it was a basis for ongoing conversations and future engagement and partnership. So if you weren't involved in those, I'm sorry. Unfortunately, due to the constraints of time and cost, we couldn't go everywhere. But it did land us on a model that I hope will be relevant, appropriate and sensitive, and we will hopefully explore in the next little while. I'll get onto that in just a moment. It outlined 3 main domains: integrated service provision, workforce investment, and how to promote genetic testing and genetic healthcare. And we asked some questions of the participants who participated in those workshops to interrogate those aspects. At the end of it, we developed up a preferred referral pathway that's really about how the tertiary hospital and health service sector that I mentioned before, referenced before, works hand in hand with our primary healthcare sector, and it's specifically our Aboriginal and Torres Strait Islander Community Control Health Service sector, to deliver coordinated quality care where we support people through their journey to access those services. I will say as well, this is actually one of the first of its kind in the world, and I'm not just talking from a First Nations perspective. I'm talking from a primary health and tertiary health coordinated care for genetic healthcare model. This we can be proud of as one of the first of its kind in the world. And our ARCHO sector have and continue to be leaders as they always have been in this space. So the framework in a nutshell, three core principles around this idea, this principle, this core notion of integrated care. Principle 1 being health promotion, Principle 2, healthcare, coordinated healthcare, and Principle 3, workforce development. For each of those principles, there are a number of themes. So, for instance, in the health promotion principle there, you can see the themes of community engagement, public awareness, and language, media, and medium being central to realising that principle of health promotion. So how do we actually operationalise this framework from a strategic perspective, and what were the recommendations? Well, when you have a look at the document itself, it's actually broken down into conversations. It outlines the key messages that arose from the consultations. It then drills down to a number of strategies and recommendations that arose from those workshops and those champions across two spaces, the Aboriginal and Torres Strait Islander community control space, but also the public hospital and health service space. And then, some recommendations for that. So if you look, for instance, here in the workforce space, you can see those conversations outlined, the recommendations and the actions that arise out of them. So, for instance, when we look at health promotion, these are the recommendations that our stakeholders, that the community control health service sector and the public hospital and health service sector identified in terms of health promotion. When we translate that into action, these are the things that can be done at a grassroots level, at a hospital and health service level, at a community level, to be able to support that goal of health promotion. We go over to coordinated healthcare. Similarly, these are the recommendations that arose out of those consultations, and then these are the actions when we turn them into actual operational, achievable goals or achievable tasks that we can do. Again, from a workforce perspective, recommendations into action. So the document was released back in November 2021. You can find it again if you want to use that QR code. My colleagues are in the room. Unfortunately, I don't think we have any print versions of this at the moment. We will be doing another print run. So if you want to pass on your details to my colleagues, I will endeavour to get a copy to you, a physical, hard copy to you in the future. So what about benefit and impact? Well, at the start I said this was all about equitable access to quality genetic healthcare. And how do we do that? Well, hopefully I've sort of hinted at how through this process we've supported community and its champions to identify need and confirm and affirm and confirm an interest and appetite and the relevance of the work. We've landed on recommendations for integrated healthcare, and we've identified actions to be able to realise that promise. And hopefully through that, we'll be able to provide equitable access to quality genetic healthcare. But I guess, it's all well and good to come up with a framework, but, ultimately you want to have this embedded in a health service. You really need to run a pilot. So at the end of last year, we proposed to the National Health Medical Research Council of Australia, the Medical Research Future Fund, Genomic Futures Health Mission, which is a mouthful to say, a scheme to pilot integrated genetic healthcare across a number of stages, a number of years, as you can see here, and you're not expected to sort of necessarily be aware of all of this, but, establishment, implementation and evaluation, essentially deploying the model of integrated genetic healthcare through coordination and a number of services that you can see over here on the left, through a governance system that is reflective of a relationship between the health service sector, the research and academic sector, and also the community sector, and operationalised at a level which is training, evaluation and coordinated care to realise three aims: to increase access to services, and then to similarly measure the impact of those through a suite of metrics and an evaluation framework. Well, I can tell you that proposal was accepted by the NHMRC, and we were awarded the grant, which I can now tell you publicly, will start probably from the middle of this year, which will emphasise a co-design phase, deploy integrated genetic healthcare, evaluate it as a framework, refine it, and hopefully deliver it for a sustained and systemic impact. So, thank you to everybody that was instrumental in getting that across the line. The other thing I can say, which is quite exciting, is that framework will actually be delivered in both Queensland and Western Australia with some partners that we have over there in Genetic Services Western Australia and AQA, the Aboriginal Health Council for Western Australia, to sort of start to explore how things that we did here might be adapted for use over there, and similarly to try to support some of the work that they're doing in their respective jurisdiction. I'd like to thank and recognise the contribution of all of the communities where we went, to the funding bodies, the National Health Medical Research Council in particular, as we go forward, Genomic Health Queensland, and the public hospital and health service sector and our partners in that space, our university partners, and of course our Aboriginal and Torres Strait Islander community-controlled health champions, organisations and services. Everyone who's been involved and continues to be involved with the work, to supporting and being supported through partnership with the community of Queensland, Australia, and internationally. As I mentioned, I'm in Canada just at the moment, to see genomics and precision medicine benefit everyone. So thank you, everyone. Like I said and promised, these are the QR codes again, if you didn't get them when I put them up before. These are the organisations that we historically worked with, continue to work with. It's not an exhaustive list. I will, also say that there are a number of community-controlled health organisations who have been involved in the suite of work that we've done. You can actually find recognition and of them in the documents that are referenced here. So thank you, one and all. And in the room at the moment, my colleague Muna Abdullah is available to take questions and also to take any inquiries that you might have. And when I get back, I'll do my best to answer those and get back to you. So thank you, everyone, and I hope this has been enjoyable, and enjoy your breakfast. Thank you.